hopefully you can all hear me and see the presentation. If anybody in Hub Cymru Africa can help me admit people to the room and deal with the chat, that would be great. Okay, lovely. Thanks everybody for joining us. This is a community webinar for us to share our experiences and kind of review what is happening in the new environment with COVID-19. So just before we start, a couple of housekeeping rules. We will be recording this activity, this webinar. So if you are unhappy about your video being recorded, please keep your video off so that it's not part of the recording. If you could all mute unless you want to speak, that would be great. And then if you would like to speak, if you could use the raise your hand function, that would be really helpful. Also, you can at any point ask questions, but right now, just to kind of kick us off, if everybody could please write their name in the chat box and say the name of your organization, that would be great. Thank you. We would also like you to complete some feedback at the end. This is really, really important to us. If you value our work, it helps us to keep going. And if you don't value our work, it helps us to understand why not. So any feedback that you have is really helpful to us. So please do use the survey at the end. If you would like to be able to see people when they're speaking more clearly, you can set your view to speaker mode. So that's at the top of your screen. You can have gallery view or you can have speaker view, and you can even pin somebody if you want to only see them, so that it makes it easier to follow the conversation. Similarly, when we go into the group discussions, if you could still raise your hand to wait to speak, and so that we should just have one person speaking at a time and we don't speak over each other. And then if you have a question to ask, but you don't want to have your camera on, if you type your question into the chat box, a member of staff will then relay your question back to the group. Okay, I hope that's helpful. Okay. If anybody has any questions, I'm going to ask Beth or Emma to tell me if there's any questions that have come up so far that I need to think of.
No, nothing so far, just intros from people. Okay,
great, thank you. Emma, should we have our first poll? So hopefully what you'll see in front of you is a series of questions which is asking, COVID-19 and lockdown have impacted our project as follows, and then it's a multiple choice. If you're able to click on the one that is most relevant to you, that would be lovely. Thank you. Do we think
that's almost anyone? Yeah, that's most people have voted. I think has everyone done what they can? I'll
okay, great.
Show the results.
Thank you. Okay, lovely. So we can see that it's pretty tight, really, with most people saying that they've managed to amend their projects to fit the situation. But yeah, like a lot of us, many of you are either pausing your projects or actively responding to the pandemic. Great, thank you. Alrighty, so if we go very quickly, thanks Emma. If we go to the agenda, to get us starting to think about the situation and to talk about it, we would like to invite Catherine Thomas from the Wales Africa Health Links Network. Catherine, are you there? Have you got your mic on?
I am, if you can hear me all right.
Yeah, okay, I'm going to pass you over. Give me a nod when you'd like me to change to the next slide, okay?
Okay, this is just very brief. Dr. Walapu, who's also joined us, who's a retired consultant in communicable disease control, and myself, we kind of put together a longer presentation which we can share with people, or we can do it another time. But we've been kind of really interested in looking at how COVID-19 has played out over the last weeks across Africa. So there's been some surprises. So we just wanted to highlight just a few issues. And I'd be really interested to see what other people's perceptions are, what you're hearing from your partners about how it's been playing out in countries that you're working with. So yeah, Predictions and Reality is a good title. If you want to move on. Now in this slide, don't worry about how complicated it is, but back in March, lots of people were doing modelling everywhere about this is what it's going to look like, this is how many cases we're going to see, this is how many deaths we're going to see. And people will have heard how that's worked in the UK. We got very panicky and had a lockdown when we had that modelling that predicted the number of deaths. The modelling was applied to countries across Africa. This is just one of them, and almost all of them predicted far more cases. So the prediction on the slide here says that by the 1st of June, every single country across Africa would have had more than 10,000 cases. But in actuality, by the 1st of June, it was only South Africa and Egypt, which isn't in sub-Saharan Africa, but only South Africa that had more than 10,000 cases, and they've now massively increased to 34,000 cases. Nigeria's just hit 10,000 yesterday. So it's not playing out as predicted. Many countries are reporting fewer cases. Clearly, it's connected with testing. If you're not testing, then you're not going to identify the cases. But it does seem to be that there are fewer cases by a long way by this point in time. So if you go on to the next slide. There we go. So you can see at the bottom here, the, oh, I've lost my view. Sorry, there we go. There are lots of these trackers going on. I've just picked one here, and you can see there the like faint grey lines is what's been happening across the rest of the world, and you can have a guess that the top ones there are USA and UK. So we have done embarrassingly badly in trying to reduce cases, and it's a log scale here as well. So, but many of the African countries have been kind of pootling along without having that exponential rise that we've seen in Europe and Latin America and North America. So Mac and I had a bit of a think about why that could be, and what the debate is in some of the, you know, the magazines and newspapers and journalism and discussions and what's coming out. It feels like there was a strong and early leadership taken. The African Union, WHO and Africa CDC set up a task force in February, so well ahead of Europe, and there was quite consistent and strong leadership across them. And I think that's, you've got some key people there. The current head of the African Union, or the country leading the African Union this year, is South Africa, and Cyril Ramaphosa and his health minister acted very quickly in South Africa. Perhaps quite draconian measures were introduced there, and that influenced right across. Also, that many countries, certainly in West Africa, have had experience with Ebola. So they are used to that kind of urgent public health, grassroots on the ground response that you need to have to control that. So the mindset was dealing with Ebola and more serious infectious diseases, whereas in Europe and America, our mindset was flu. So they had an advantage in the way they approached. There was also fewer transport links, so less travelling between countries and in and out of countries. So it doesn't seed outbreaks in a similar way. And also the population, there are a much lower proportion of older people who have been the most vulnerable to this. And some of the literature I've seen is that on the whole, you take the whole of sub-Saharan Africa, it's about 16% of the population that falls into the risk groups, you know, with chronic diseases or over 60, whereas it's about a third of the population. So, but what's going to happen next? Who knows? I mean, Mac and I didn't really know. Was it going to carry on burbling along, gradually rising? Was there going to be frequent waves? And the other thing, which people here will know more about than we do, is the impact of the control measures. That lockdown buys you time, and it's bought time across many countries, but many of them are lifting their lockdowns already because the impact of the lockdown has been more drastic than the infection itself. So it's kind of playing out differently to what we would have said 3 months ago. And I'd just be interested to whether that kind of chimes with people's experience over the last couple of months. So happy, you know, if there's any questions later, please do, but it was just kind of setting the scene. So thank you. Kath, you're on mute, I think.
Sorry, I was trying to find the unmute button. Thank you very much, Catherine. Appreciate that. I found it really interesting. Does anybody have any questions? Beth, have there any questions popped up whilst
No, nothing in the chat, no.
I think we've got a couple of minutes if anybody does have any questions or any comments. Are we good?
I've just got a comment.
Yeah, who's that? Sorry?
It's Jenny.
Hiya.
It's just I couldn't see Malawi on your list there. I just wondered if you have any information about Malawi, which is where our project is.
You mean on the chart there? Because there's only a few countries on the first one.
No, on the first one, yeah.
Ah, do you know, it might be worth asking Mac.
Okay.
I know Lesotho isn't on there either. There's a couple.
No, it's not. No.
There. But Mac, you might be able to pick that up from your local knowledge.
Yeah, I can come in here. Unfortunately, the situation in Malawi is getting quite out of hand, mainly because of returnees from South Africa. Because of the lockdown in South Africa, a lot of people experience hardship, and people from neighboring countries like Malawi who went to work in South Africa didn't have a means of livelihood. A lot of them have had to return to their countries of origin. And in Malawi, when we last started looking at the data, there were 336 cases, confirmed cases. And of those, more than 80% were returnees from South Africa. Before the returnees started arriving in Malawi, we only about 50 confirmed cases from indigenous local cases. And the returnees from South Africa have made the situation quite critical. To add to the situation, the returnees are being, well, they're supposedly to be put in quarantine, but about 400 of them were put in quarantine in a stadium in Blantyre, but they had no facilities, i.e. they were not being given support in terms of food, etc. So they were going to local shops, etc. And then they decided they decided all to abscond from that particular environment they were put in. So they've all gone and they don't know where they are. Well, the authorities now say they'll put measures in place to make sure that the returnees are put in quarantine properly, but the situation is quite complicated because the political situation in Malawi is quite unstable at the moment. So watching it closely, as it were.
Okay, thank you. That's very helpful. Thank you.
Thank you, Mac. Beth, Emma, are there any comments or questions that have come up whilst?
Yeah, there's a question that's been answered by Catherine about whether the data collection is disaggregated, and the answer was yes, if you look on the CDC, Africa CDC website. Then we've had a couple of things come in. Is there any information on any countries that will be changing their testing strategy? Is there any correlation between low numbers of cases and capacity to test and trace? Yeah.
Do you want me to? The interesting thing, obviously, and that's been, we all hear it in the news here, is that if you're not testing that many, you're not going to be finding all the cases, clearly. But there is a kind of way of looking at that. If you're doing, however many tests you're doing, you really want less than 10% of those to come back positive, to have some idea that you're doing enough, you're catching enough. So in this country, like I looked yesterday in North Wales, about 17 to 25% of tests are coming back positive. Now that's a sign that we're not picking up enough, we're not testing enough. But in quite a few sub-Saharan African countries, the percentage positives coming back are less than 10%. So that's a sign that you probably are picking up. You know, even though you're not testing a huge amount, there genuinely aren't that many cases yet. That's not, it's everywhere is different. You just heard what, you know, about detail about Malawi. Every country is different. And there are some countries where they really are not testing enough and they've got far more cases. So you'd have to dig down into each country. You know, Kenya is very different to Senegal, is very different to South Africa. You know, Lesotho's only got 4 cases. Now, I'm sure there's more than that, but I don't think that they have got sustained community transmission yet. So it's incredibly variable, but you can kind of guess by the proportion of testing that you're doing that's coming back positive.
Thanks,
does that answer that question?
I think it does. Is there? Yeah. Rebecca's nodding.
Yeah, the testing strategies, I have to say, the testing strategies seem, because countries are generally following the WHO guidance, unlike the UK, the constraints are just about capacity, aren't they? About resources and amount of money and number of people. But in terms of testing strategy, from what I'm hearing, most of them have actually got a plan on who they're testing and why, unlike ourselves.
So Catherine has shared with us quite a few resources, and we will be sharing that in the post-webinar email. So if you keep an eye out for that, there'll be a wealth of resources, both from Hub Cymru Africa and from the Wales Africa Health Links Network, that will help you hopefully answer some more of those questions. Okay, I think if it's okay, we move on to the next case study, if that's all right. Okay, great. So unfortunately, Lois, unless, Lois, are you already in here? I think Lois is having difficulty getting in. I'm just trying to scan through you all. No.
Lois is in.
Lois is in?
Yeah, it's what it has been following from the beginning.
Lois, where are you?
Okay, thank you. How are you?
She's
I'm good, thank you. How are you?
4.
Okay.
Hello, Apollo. Hello, Lois.
Hello.
Hi, how
Hello.
are you?
I'm good, thank you. Welcome. Thank you very much for joining us from Uganda. Really appreciate your input here. For those of you, Lois is are you the health officer for Mbale Cap, is that correct?
Yes, please.
Please, lovely. If you could talk a little bit about your work and help us understand the situation in Uganda, we'd be really grateful, and how you've been responding.
Thank you. In Uganda, the situation is under control. So far, the total number of infections is now 557, and the 88 have been discharged after treatment. So generally, it is under control. In Mbale, on Mbale Cap, we work to give information. We share knowledge. We have been sharing knowledge about COVID so that people are able to take care of themselves. And as an organization, we have ambulance motorcycles that are enabling the transportation of the cases that are found sick. I don't know what else you'd like me to add. So we have trained 600 community health workers who are out sensitizing people and educating them about the problem of COVID-19. With our motorcycle ambulances, we have tried to put them in a good condition and ensuring that they have fuel and the riders are motivated so that they are available to respond to any emergency calls in the communities. We have also tried to provide soap to enhance the sanitization. We are also providing some food to the most vulnerable families that are unable to afford anything at a time like this. But we work with partners. We are not alone. We have partners in UK, that is Point UK. They are the ones who have mobilized some resources for us so that we are able to do these activities. Within Uganda, we work in partnership with the district health offices in 4 districts. And we also work with NGOs, 8 NGOs. 8 NGOs that are the ones that are mainly doing the trainings so that we are able to give information. We have the knowledge and the information people need to know so that they fight this problem of COVID. As heard in our situation, has been big, actually quite bad, especially it has affected people who earn daily, who make their incomes on daily basis. What they earn is what they eat every day. Now time comes that all businesses are closed, so people have no work and therefore no money, and they cannot provide for their families. And that means that feeding is very poor. Now, feeding is poor, you know, the health will also be poor. Many pregnant women, because of poor feeding, have developed anemia. Children below 5 years have developed the deficiency conditions, the kwashiorkor and marasmus, and anemia among children has been very high. And then the education system has also been affected badly. Right now, we actually don't know when the schools will open. The children are still at home. They are so restless, and so they watch TV all day. They move from place to place because they don't know what to do with their time. And many girls have got pregnant. Some of those who have tried to abort have actually died. And some girls have chosen to get married because they can't stand the conditions in their homes. Another way we have been affected is our motorcycle ambulances have been on ground doing good work. But recently, in the last 2 months, they have been strained because they transport all cases. All other means of transport has been closed except our ambulances. They are the ones which are available to serve. And so they have been overworked because the transfers they make every day have been doubled. Within a month, you find they have transported about 40, and yet in the past, they were carrying about 20. So they have been strained, and the cost of maintaining them has increased over time. Any questions?
Thank you, Lois. That was really good. It was nice to have a good covering. I can see that Beth has got a question, but I've just got a really quick question. Do you want me to stick it in, or are you okay to go, Beth?
No, you go first.
I just wondered if you had any barriers. I know you said you've been doing work in the community and going out to the community, and I just wondered if there were barriers for that. Being able to do that work.
Thank you. One of the barriers has been transport. Transport for us actually to be able to reach out to meet the people who are participating in the training, so that we are able to actually see the real situation has been a challenge. But the good thing is we have been in touch on phone with our partners, and then we also were required to get permission from the security team or the task team at the district. So they granted us permission to use our vehicle to reach out whenever we wanted to go. So that is how it got solved. But earlier on, it was a bit of a challenge moving out. And even the trainings were not conducted. The number of people we trained should have been many more. The community health workers should have been even over 1,000. But because the numbers were limited because of social distance, we had to have very few people trained at a go, and that one took us long. But all the same, the 600 that have been trained are doing a good job out there, sensitizing people from door to door.
Lovely. Thank you very much, Lois. That's brilliant. Beth, was there any questions that you wanted to?
Yeah, there was a question, Lois, about have the health facilities had to change what they usually do, the usual services they offer, such as vaccinations or maternal health?
The health facilities have been doing their work as usual. They have continued to do everything they were supposed to do was going on, except that the turn up for some cases was poor because of poor transport, lack of transport. Many communities actually are not served by this ambulance. Many communities don't have ambulances, so they don't have support, and so many patients were not able to reach health centers. And so much as the health facilities were available to serve, the turn-up of patients was much lower because of poor transport or lack of transport.
Lovely. We have one more question, Lois, about personal protective equipment, and has that been provided for care workers? Is it considered necessary or useful?
Thank you very much. That is our big need. We actually, when you talk about that, we think of our community, the drivers of the ambulances. They are the ones transporting all kinds of patients. Some of them might be infected and not known. Now, these drivers are just transporting without any protective gear. They actually don't have anything for protection at all. And so they are at a high risk of getting this problem. And the rest of us, even us as we go out to monitor, we are equally not well protected. So we are all at risk.
Okay, lovely. Thank you very much, Lois, for sharing that with us. I think we've got a couple of minutes if anybody has any last question, or
I think Norbert wanted to say something earlier. Should we come to you, Norbert? Is that?
Yeah, sorry, thank you very much. Yeah, I think thank you to Lois because the picture is giving us is really the real picture from the ground. And my background, I work in WHO and DRC, and as a journalist, I was in the region when we got to the second Ebola, abandoned the region. And also 2 months ago, I was back in Africa, going to Kinshasa via Addis Ababa. So when I came back after 1 week, I listened to the media, I listened to our government in the UK, I listened to the experts of WHO, whoever. I was laughing. I was laughing because you know what we have now in America with Black Life Care. We need to start thinking also Black knowledge care. Because working in the WHO in immunization program, reporting about the Ebola in DRC, coming from Africa, I was surprising how people in Africa, in Addis Ababa airport, for example, they was checking everyone almost 10 times. When arriving in Kinshasa airport, they would pick up the temperature, whatever, and screening people. And coming from Heathrow, it looks like I just get in my plane. And when I came back, I was also surprising that, I look myself, I say, those people, they never experienced Ebola, they don't know really. So to be honest, people in Africa, they care, they got the experience, they know that in Africa, people doesn't have all those facilities we have now. So they are struggling, and the people, they listen to them. Because we don't have the media in Africa as we have now, but the people, they try to find a local solution, how to pass the message and how to take them serious. So what we need, I think it's important for us from the West side to start also listening from people from the other side, you know. And I was in WHO in Kinshasa. I've met with some doctor. They was saying, oh no, it will not spread here as it spread in Europe because we don't have the facilities, but we will do our best. And the people, they work really on this. So now the problem is the next step, what we must do. I think it's important for us, and luckily, you know, from Welsh, we have another way of working in the partnership. The London side, I think things, I think they have another way of dealing with Africa, and they are not listening to African, I will not say to Black, but to Africa. If you, I tried, for example, for the first day when I came back, I tried to get in touch with the Premier Minister press, daily press conference, just to mention, I said, look, I have not seen any Black journalist invited there. What we must do, because we got issues in the Black communities, issue of misinformations, because people, they thought that, oh, this disease is not for Black people. But you know how many people are dying now? So, but by the same time, are we thinking to set up a special Black media covering all those things? Nothing till now. So we need to start to really shift our way of dealing with Africa and with Africans by listening to Africa, to Africans living with us. We don't need to really, when people start dying and we do the statistic, but when I came back from Africa 2 months ago, I look, I say, my God, people will die here. People, African people will die, because when I came back, I passed by London, no, people wasn't thinking, no, this is for white people, not for us. I look at them, I say, my gosh, we will lose it. And now we are just pick up our statistic. But now, after, we need to start thinking really how really to work, how really to take, how really to consider the Black and African knowledge in whatever we are doing. And this, and as African, we listen, we understand that we need to work in partnership with, you know, Chinese, with white people, and this is important. But the opposite, I think we don't have the opposite answer of people. And I check this is network. How many African people are there in this network? I don't know. Probably I'm wrong. Probably 2 or 3. But how many African people we have in Welsh and working in the communities? And the people, what they say, oh, those people, when they go there in Africa, they go doing their business. They don't want to listen to us. And no, I think we need, let us take, you know, the crisis we got now to say, Black knowledge care, Black leadership care is important for us to work with those people. And if we listen to them, if we listen to African people, probably we will not have all those 40,000 people died, to be honest.
Thank you, Norbert. I think you made some really, really important points there, and it's definitely worth taking on board and thinking about those further. Thank you very much for sharing with us. I can see that whilst you were talking that Catherine Thomas put her hand up. Catherine, did you want to say something relevant to what Norbert was saying?
Well, I think he's absolutely spot on, and it's connecting what we see playing out across sub-Saharan Africa, and I think one of the big reasons is the strong leadership, Pan-African leadership, and it's because the white experts have kept out, have been so absorbed with trying to manage things back home. And I think that's a factor, you know, that you have the power balance has changed, and it's fantastic to see. And it's reflected here. It's the virus has really exposed weaknesses in every country, and here it's exposed structural racism and the institutional racism, and it's clear that it's right through the health service. And the fact that we had a report here, I don't know if Norbert's seen that, the government commissioned a report on why BAME people were more likely to get the virus and die from the virus. And it did not mention racism throughout that report, in spite of the fact that more than 1,000 people had contributed their viewpoints on what the factor was. That was all completely cut out of the report. So the government does not even acknowledge it. So I think we, here in partnerships, I think we could do with exploring our kind of unconscious racism that we are actually bringing into. I agree with everything that Norbert has said, and I think you can see it playing out quite dramatically right now.
Thank you, Catherine. Thank you, Norbert. I'm really sorry to move on from this conversation. I think it's really important, especially at this time, but not just at this time, always this conversation is really important. And I'm sorry that we don't have time to dig a bit deeper into that right now, but maybe we can set up a separate webinar discussion to kind of look at that in a bit more detail, if that's okay. So, is it okay if we carry on to the next speaker? The next person that we have, Lois, sorry, Lois, thank you very much. Thank you very much for that presentation. Really appreciate you taking your time to join us. Thank you.
Can I say something, huh?
Yes, please do, Lois, absolutely.
I saw a question up here that whether I agree with the fact that masks should be made official. My opinion is that it's necessary to have them official because you can never know what your neighbor has. It's possible to be infected without knowing, without any signs. So the only way you can be safe is to have this mask on. So if they can be made official, maybe even those who are not aware of their importance can be helped to use them so that they can be safe. Thank you very much, Kath and the company, for giving us the opportunity to be part of this conference.
Thank you very much, Lois. Really appreciate it. Thank you. I hope you'll stay for the rest.
Thank you.
Okay, so we're now going to move on to Ziz York. Ziz works for Teams for You, and she's going to be talking about Project Adaption. Ziz also works in Uganda, but also Sierra Leone. Ziz, over to you.
Yeah. Hi, everyone. Lovely to be here and to chat about how we're all adapting to, in response to obviously what is a global pandemic, and it's all affecting us in very, very different ways. And I think a lot of us have experienced major change in how we can run our projects across Africa. And particularly in light of the restrictions that lockdown poses. So I've been asked just to chat about how we've adapted 3 of our current projects in Africa. It has definitely been very challenging. I'm sure all of us have been in those moments of wondering how on earth we're going to actually make anything work, but thankfully we have been able to make some adjustments. So if you go to the next slide, please, Cass. So this is the first one that I would like to talk about. UK will probably be disappointed with me in how I've used their logo, but this is our response. So we work in the Kumi district of Uganda. It's quite a rural district, and it's got 7 sub-counties, and we had a sanitation project that had just been approved, funnily enough, before everything went into lockdown. And the sanitation project was focused purely on supporting schools. So the idea was that you can see the middle photo there of the tank in the concrete base. So the idea was to put hand washing stations into 20 schools, very similar to the ones pictured here. And then the schools closed. So we had to wonder, you know, what we were going to do. Now, obviously, we had discussions with our funders, and we agreed that we would still install those tanks because eventually the schools will open, and they are a community resource at the moment because there, as everyone is very well aware, very few households in really rural communities have their own hand washing facilities. So these sort of, they become communal resources too. But we were able to talk to our funders and sort of say there are things that we couldn't do. So we were going to do quite a lot of sensitization with teachers. And we were going to do that in a seminar format. So that was everybody together, which obviously with social distancing restrictions and lockdown, we weren't able to do. So we talked to our funders about reutilising that money, and we started doing community interventions. And I think, as Lois pointed out before, you know, that these things require official permission. And that was actually quite difficult to get because, as you can imagine, no one's in their offices. They might not even be answering their phone for whatever reason. So tracking down the right permission to be able to move around the district and be able to distribute anything was actually did take us quite a lot of time. But we eventually got the President's officials' permission. It helped. There was a quarantine centre being built on the main road in Cumie, and we were able to provide them with a hand washing facility and soap, and that kind of paved the way for permission to do community interventions in the district. So we've been able to go out and sensitise people at local markets, health centres, and provide them with hand sanitizer, our own liquid soap that we make in our vocational college in Cumie, and these water butts that you see. So those hand washing portable stations have gone out to particularly to health clinics. And we've been able to fund through that about 8 at the moment, and still raising funds for that. So that's how we've kind of adapted our sanitation project, just shifting a few things that we were originally planning to do. But we are still training and sensitising the teachers in preparation for schools to open when they do, and we're doing that one-to-one, so that's a bit different. But yes, but if people want more information about this, I know I'm quite limited on time, please do contact me. Kath, next slide, please. Okay, so the other one is this peer mentoring program. Now this was fun, can you imagine? So this entire project was based on the premise that we would go into schools to evaluate teachers delivering to pupils, and the mentoring program is a sexual health program, because we discovered that the teachers, particularly in primary schools, and the demographic in primary schools, you know, quite a significant proportion are in their teenage years. And they were not getting information in time, timely information on menstruation, on how to protect themselves from, you know, within sexual activity. They weren't getting any sort of standard curriculum on puberty. So we started our mentoring program, meeting teachers, talking to them, helping them with resources, help them create their own resources. On puberty, menstruation and their sexual health. But the whole premise of that was that Christine, who you can see pictured here, would actually, with a few of the rest of the team, would go into schools and would actually watch the teachers delivering the information, sit with them and help them design their lesson plan, plan an action plan for the year, etc. So when schools closed, we were like, do we pause this? Is there any way of, how do we do this? So we've sort of reshifted the entire model. So you can see Christine here. So she's actually going out, she has permission to do so, one-to-one with the teacher. So it's not obviously within class, but we've used the time instead to do a lot of content generation. So we've taken back all the feedback we've learned from the previous year running this project and looking at all the gaps in knowledge and really getting, in fact, Catherine Thomas helped, she's on this call, she helped as well provide information on this. And we've just really honed in resource creation. And you can see a little comment in the photo from one of the teachers just saying how much that material has helped them. And then we do lots of follow-up phone calls. So we're using Facebook, WhatsApp, standard phone, and one-to-one visits to keep this mentoring going and keep these relationships going with these teachers, so that when school does open, they are ready just to hit the ground running with this sexual health programme, which I feel is actually quite critical at the moment, because as Lois said, you know, there's been such an increase in sexual activity in teenage pregnancy, in child marriage through the lockdown, and we saw that before we did any of this sexual health programme. And the sexual health programme was a response to that reality, that daily reality for young people. And some of the feedback we've had, you know, in our first year, we now know that 60% of pupils in mentored schools are more likely to receive regular lessons on their sexual health from the age of 12 than those that are not part of mentored schools. And there's even been a 16% positive improvement in attitude change to the use of contraception. And that's what was recorded before the lockdown. So hopefully our mentored pupils are using contraception, but we'll see when we're able to go back and do some monitoring. And the next slide, please. Okay, and our last one again was a Welsh funded project in Sierra Leone. So Sierra Leone, we have a COVID response there too, but it's mostly kind of a lockdown response. So it's providing food to those that desperately need it. And we also manufacture and distribute face masks there. But we have had a sexual health program there too. And you can actually see Helga there. She is training some teachers from schools on menstruation. So again, this project was meant to run in May, and we were actually going to fly over and run it. And obviously that all went out the window. So we had to decide, how are we going to run this project? Can we run this project? We were like, I honestly did this. I crossed my fingers. I wasn't sure. And I had to have lots and lots of conversations with Helga to see if we could run it, because Helga had never run anything like it before. She'd never done this kind of training. She's a teacher, but she'd not done sexual health training. So we actually went, okay, let's practice with Zoom. Let's see what we could do. And we mentored her through Zoom, and we sent loads of materials. We worked really hard with our teachers in Uganda to create materials that could be used in Sierra Leone. Then Helga used those materials, went out, got some feedback, so that we could adapt it to be specific to her area. And then she was able to go and do training in small groups, which was allowed in Sierra Leone within their lockdown. And we were able to provide them with lesson plans and information. And the feedback was immense. The teachers were so surprised to have this investment, particularly in lockdown. They weren't being paid. We were able to give them some allowance. So they felt really empowered by it. And they've said that they've all learnt themselves about sexual health and menstruation, not just that will empower them to speak to the pupils. And we even had some men at that training, and that was very entertaining, because they genuinely believe that you only ever talk about menstruation to the people, the wives you're married to, and it never even occurred to them that even though they are, as a patriarchal society, they're the ones that buy the sanitary products, etc., that this was a subject that should be less taboo. And most of the teachers are also male in the communities we work in, so we were having to kind of say, you know, try and break down some stigmas and some cultural barriers in talking about these things. And that's how we sort of managed to wrap up Sierra Leone. We're still working with them, mentoring the teachers through WhatsApp, so that if they have any questions on the material that they were trained in small groups, they can come back to us. And that's how we're sort of making that project work from a distance. And that's about it, I suppose. I went through that very fast, I realise. So if anybody does have any questions, I've seen them, a question from Dina about sharing the sexual health training. That is definitely something we want to do. I will be very happy to share what I can to anybody that wants it.
Brilliant. Thank you very much, Liz. Appreciate it. Does anybody else have any questions? Beth, did any questions come up?
Yeah, there's one in the chat from Catherine asking, do you think closing the schools has done more harm than good?
Of course, it's difficult to know what the effects of COVID would have been if it had been allowed to run rampant, particularly as the health facilities. Your lack of basic essentials is ridiculous. You know, that if you don't have soap, how can you protect yourself? So I completely understand how Uganda's locked down. However, everything we're seeing on the ground is actually quite devastating to people. As Lois said, if you can't work, you can't eat. The kids can't leave their compound. They're split from the wider family, the wider community. All faith groups obviously have closed, which is significant. It's how people learn about what's happening in their community. It's the sexual abuse, domestic abuse, all of that's increased, probably more than we've even seen. So yeah, I can't say as a medical person whether it was, but in my view, lockdown has been absolutely devastating. And we're gonna, all of us as our charities are gonna be having to deal with the long-term ramifications of it, I think.
Lovely, thank you. And there was one other question that's been answered around sharing bars of soap and whether that's safe. And Catherine, as you know, who works for Public Health Wales, says yes, it's absolutely safe to share bars of soap.
Okay, brilliant. Lovely, Ziz, thank you very much for sharing that with us. I think it's been really interesting to hear you talk about, especially about the doing the remote support and how you've had to adapt that. Great, thank you. And there is going to be another webinar that we'll talk about later, but that if anybody's got any more questions about giving remote support, then some of the e-learning things will be covered next week. All right, great. So now I would be really interested to, if you're all happy to, I'd like to kind of break up into breakout rooms so that we can have some more face-to-face discussion as a group. And so I think if it's okay with you, we'd like to ask a couple of questions. The first one being, how are you responding or adapting to programs in the context of COVID-19 and lockdown? What are the constraints and challenges, e.g. funding, access to communities and resources? How are others responding, and are you able to collaborate and coordinate? For example, governments, NGOs, community-based organisations. And then also a question around if you're able to plan for the longer term. How are you planning for the longer term? So I'm going to stop sharing my screen so that I can see you all. And I'm going to put you into I'm going to put you into breakout rooms. I always forget that word. Bear with me 1 second. Hi everybody, welcome back. I hope you enjoyed your breakout rooms. Can I please ask somebody, anybody from the group on responding or adapting to programs to give us a brief summary of what their group talked about?
I'd be happy to do that. I just have a delivery arriving at the door, so could you go to another group?
Is that, yeah, let's go to the next group. Let's go.
Sorry, I'm really sorry. Talk about bad timing.
Okay, how about what are the constraints and challenges? Who was that group?
That was us. Yeah, I can just summarize what we discussed. So we had Lois in our group and Howard, who's working in Zambia. So we had Uganda and Zambia context. So Lois had already discussed quite a few of the challenges in her case study earlier. So we talked more about the lack of transport and the impact that had. So obviously that's a huge impact in terms of people being able to access healthcare, being able to access medicine and so on. And there's been obviously a spike in particularly pregnant women, higher maternal mortality, just not being able to get to the health centres and hospitals. And also then the health workers and the NGO workers also not being able to travel and to get to work in order to treat people. And then the ambulances that we talked about not being able to reach everywhere, and it's put a lot more pressure on those who are working. Also the issue with the motorcycles not being able to be maintained. So there's been more breakdowns and that's impacted the work. And then what we also discussed was the PPE, lack of PPE for health workers and the impact that that's having and will continue to have. And in Zambia, we talked about, again, lack of PPE, and the pupils are being asked to buy masks, which obviously is a barrier to people having them. Lack of water, so even if you have soap, they're not be able to wash their hands and access to sanitation. And the need for health messages and education, particularly in rural areas, and the communications being an issue. Does anyone from the group want to add to that? That's a brief summary of what we talked about.
No?
She has presented it all.
Sorry, Lois, could you say that again?
She has brought out all the points we discussed. I don't have anything new to add.
Okay, great. Thank you. Thanks, Emma. Beth, are you back? Are you okay?
Yes, I am. Sorry about that. Okay. Go on. So we were talking about how our group's responding or adapting. So there were sort of two strands. In terms of adaptation, it was by so we had people working in Cameroon, Zimbabwe, Lesotho, and Zambia in our group. So adapting by going online, trying to take sort of the support that we give to projects remotely, and talked about some of the challenges around that, both in terms of culturally how people respond to sort of meetings online, and also then technically in terms of bandwidth and ICT equipment and how that presents some challenges. There was also adaptation in terms of meeting immediate needs, so sort of diverting funding towards getting food just to feed people who aren't able to access food or income during the lockdown. And then Erin was talking about how they were able to respond quite quickly in Lesotho because they partner with the Lesotho Red Cross, who was able to still work under the lockdown there. So that program was still able to take place. And then also Dina was talking about in Zambia how they provided soap and water to rural health centres rather than the usual work that they do in schools, but now schools are reopening, and they've done WASH training and how that's stood them in good stead for dealing with the COVID crisis at the moment. So again, that was a very brief summary, so if anybody from our group's got anything else they'd like to add, please do pipe up.
Does anybody want to add to Beth's summary, or do we think she covered it? Silence. I'm going to say, Beth, that you covered it. Well done. Thanks, Carol. Covered. Okay, and there's a couple of questions that have popped up, but I think if we just go to the last two bits of feedback, and then we can look at discussing some questions as a group, if that's okay. Catherine, you were in the group that were talking about how others are responding and if you're able to collaborate and coordinate. Can you talk us through that, or somebody from your group talk us through that? It's quite stressful, this breakout thing, isn't it? Sorry. I was going to see if I could share the screen, because I've tried to keep notes on a. Are you able to let me share the screen? Please do, yeah. I might need to make you co-host. Bear with me 1 second. Okay, yeah, you should be able to share your screen now. Okay, see if I. Right, okay. So we had people from, can you see that? Yeah, we can see that. So we had people who were working in Uganda, Sierra Leone, Kenya and Lesotho, and we were talking about how others were responding, and NGOs and so on, and collaborating together. And I think what's come through is, because of lockdown and people not being able to move freely, everybody was kind of saying it's a bit of limbo time. That was the word that came up at the end, but that if you were not already active somewhere, it was very hard to get activities going because of the limit in being able to move around, to get from one district to another. So awareness of what others were doing was quite difficult, because you didn't have those connections to the next district. And as Liz has pointed out, it takes time to convince the authorities that you can do what you're going to do, and that you need to get active. In Lesotho, there's had a really good description of the kind of command and control at government level. So there is a command centre in the capital, and scientific advice going into that, and daily broadcasts on TV and radio to reach members of the public. So it just sounds like that's a solid government response, you know, so to back up what NGOs might be doing locally. But also the difficulty and capacity, you know, the government doesn't necessarily have the capacity like to do tests. And I think everybody spoke about the negative impacts of lockdown, that people are living hand to mouth anyway, and they've lost that kind of it's food insecurity and financial insecurity, isn't it? People are losing any kind of security, so people are really threatened with hunger. And then if you're in a rural area, you are stuck with difficulty in communication. So, you know, with the internet access and paying for data, those kind of constraints that are there in normal times are aggravated at the moment. People are even more cut off than they used to be because of lockdown. Is that, I'm looking at my group there, because it's quite diverse settings, which is interesting, different countries and different perspectives. Have I left anything out there? No.
I think you covered it, Catherine.
Okay, great. All right, thank you. And then, so that not everybody's always listening to my voice, Paul, are you happy to share about our group and what was discussed?
Not entirely, but...
no, it's okay. Sorry if I put you on the spot. I can do it if you want.
Well, there's a danger of putting my point first, you know, because I'm terribly biased.
Shall I go ahead then? I've got some notes, and Gary and Paul and Peter, if you want to chip in with me if I misrepresent or remember something incorrectly. We did talk about looking at we talked about you know, WASH and prioritizing WASH. We talked about well-being and thinking more broadly about the well-being of the communities that we're working with. Gary was saying that his work has had to be frozen, paused for now, and that there's time to reflect. We talked about Black Lives Matter, we talked about colonialism, we talked about the impact of those on our work and on our approach. And it is something that's been brought up earlier in this webinar, and I think it is something that is really important that we think and reflect on in terms of how that influences our work and our role in it. We also had, no, I think that's it, that's what I've got around that. Have I missed anything? Is there anything else that I missed?
Yes.
Go on,
Sorry.
please do. Yeah, no, do.
I think I made the point, and I didn't hear disagreement, was that to some extent we should, given that we were asked to look at the long term, we should not allow ourselves to be totally distracted by the current crisis. A lot of us got some very good long-term programs, and the same problems are sadly going to be there after COVID. They might be manifesting in a slightly different way and might require slightly different approaches, but let's not divert all our attention and resources to dealing with this problem. Let's make sure that we can carry on doing the good work that we're already doing afterwards.
Yeah, absolutely. I think that was the key point. Thank you, Paul. Thank you. So before we move on, we are a little bit short on time, but Beth's got her hand up. Can I ask you to?
Yeah, just we've had a couple of questions come in through the chat. One about the best way to send out health messages. We've had people saying WhatsApp and social media get them across, but if anybody's got any other suggestions around getting public health messages out successfully. And then Paul's raised the issue of how do we make wash facilities, hand washing facilities inclusive. And then finally, Paul has asked, what should we do? What should NGOs do if governments get it wrong? Do we toe the party line or support evidence-based activity? So those are general questions. I don't know if anybody's got any responses to any of those.
I can discuss I can't say the word. That's terrible. You know what I mean, of hand washing facilities. I mean, it is definitely tricky to make a permanent hand washing station accessible for everybody. But one of the factors we put into the design of ours, having talked a lot about it with the Sanitation Africa who installed the tanks, was trying to think about how pupils could access them if they were, had physical disabilities. And the main one was keeping the taps quite low, so that they're not too high up. So we have, our taps are quite low on the base of the tank, and making sure the placement of the tanks are on as flat a ground as possible, and not too far away from the toilets, helpfully, and also providing the portable hand washing ones directly outside classroom doors, which is great for when, obviously this is all when schools are actually there, which at the moment they're not. But those are some of the things that we have tried to do to you make sure that everyone can access those facilities. And there is obviously lots of information from other NGOs as well of how they're doing it.
Yes, I think that final point is what Paul is saying that there are organisations that you can look to have more information on that. You've mentioned WaterAid. Was there anybody else you wanted to highlight, Paul? Or Lindawood? No? No? Okay.
There's a bit in our resource list about this as well, because I know Fadili's been working on it with Paul. And when we send out the email, there's some things on inclusion in that list too.
Okay, great, lovely. And I very much like the question about if governments get it wrong and what should NGOs do. And I think I'm going to pin that to include in another conversation as well. What do you think, guys?
Yeah, next webinar.
All right, I am going to share my screen again because we are trundling towards the end quite quickly. Let me just double check on my time. Yeah, we've over time. I'm really sorry for anybody who needs to go. We just really want to quickly highlight. Emma, do you want to talk through this very quickly?
Sorry. Yeah, sorry. Just, yeah, just to say, we're going to send out a resource list after the webinar, so I won't go through this in detail, but we've got some resources on our website, some news and updates. We've also got WhatsApp groups, which we'll put in the chat, and that the links to send out as well, and some health messaging resources translated into different languages. And then there's some more health messaging resources. This is, we had a distance learning webinar last week, so I've got the resources there. And there's some really good stuff on the Hygiene Hub and the Global Wash Cluster and so on. If you tab, yeah. And then, yeah, the CDC is obviously the place to go for core information about what's going on in the countries. And they've got some great stuff on there. WHO Bond, UK Aid Direct and Small Charities is more UK focused. The CDC, WHO and Bond are all doing webinars, which especially the CDC one's really useful. And then I put some links in there about inclusion as well. So there's lots of really good resources. It's just having the time to look at them. But we'll send that out in the list after the webinar.
Lovely, thank you, Emma.
Yeah, Paul's just said that DWA are developing a resource to send out as well, which Vidya is sent.
Excellent, thank you very much, Paul, appreciate it. And also there were some resources that Catherine Thomas from the Welsh Africa Health Links Network will be sending, so we'll pull all them together. Really quickly, can we do a quick poll? Emma, do you think we have time to do a quick poll, or shall I just fire through it?
Up to you. It'll take a minute.
It'll take a minute. Is everybody okay if we do just a quick poll to kind of sense check where people are? I can't see all your faces. Yeah, okay, we'll do it really, really quickly.
Okay.
All right, so consider funding available to you and your organisation. Can you tick the one that's most relevant to you? So, you know, for example, our project funding has been paused or stopped. You have more opportunities for funding, you have less opportunities for funding. If you could all just really quick, can everybody see it? Yeah, there's things coming through. I think that's everybody, isn't it?
Yeah, nearly. Yeah, shall I?
Yeah.
Show the result. Yeah, here we go.
Thank you. Right, so a large number of you are saying that funding for your ongoing work has been reduced and that you've repurposed your funding to respond to the pandemic. Okay, so I think that does highlight the need to kind of be thinking about or talking to funders about longer term planning and the fact that life does go on and that there are other needs that will need to be addressed after funding. Does anybody want to comment on that? Okay.
Can I just ask, is there any news from Welsh Government grant scheme, because they were kind of reviewing the next round and how that was going to work? Have you had any updates on that?
Beth?
Not at the moment. They were hoping to be able to launch something next week, but yeah, we haven't got a confirmation definitely of that yet.
Thanks, Beth. Okay, lovely. So just on fundraising, really quickly, public fundraising, some groups have seen really good results with public fundraising and to putting out shout outs for one-off donations online. So we do recommend giving it a punt and having a look at your comms. If there are things that can be immediately supported in particular that's effective with. There's some new tools that we didn't know about before, or whether they're new broadly or just new to us, we're not sure. But Instagram has now got a live donations button, as has TikTok. So if anybody is using those platforms for their organizations, it might be something to look at if you haven't used it yet. Similarly, trusts and foundations, as we've discussed, many trusts and foundations are repurposing their grants to look at COVID-19. We recommend that you have a look at signing up to our newsletter if you don't already, and we have a special newsletter that now comes out which looks at funding and will tell you about upcoming funding opportunities. Speak to your current grant giving organisations and find out from them what they're doing, what their plans are, so that you know your opportunities. And finally, I do want to talk about in-country. So we've been doing some work supporting organisations in country to apply for grants that NGOs that, you know, Welsh-based organisations can't apply for. But it is really important to, if you are able to support your in-country partners that you have relationships with to do their own funding applications. It's often a barrier to that. So offering a hand to be able to help with those is good practice. It's good for sustainability, it's good for skills building, and as well as independence in terms of accessing funding during these challenging times. Poll time. So this is now the very last poll, I promise. We are hoping to we'll stick the poll up, and then we'll also chat through some of the questions that are sticking up, that are popping up whilst you're doing your poll, if that's okay. This is about feedback. As we said, we like to learn. Unfortunately, with polls, you can only click a multiple choice. And so if you could complete that for us, that would be helpful. But also at the end, the very last slide, we will have a survey, and that gives you more opportunities to talk a little bit more about your experiences. And like the poll is just a click thing, but it does help us a lot if you can feedback, please. Thank you. Beth, do you want to go through some of the questions that are coming up?
I think. Oh, sorry, in terms of the poll? Oh, I can't hear you, sorry, Kath.
Sorry, I couldn't unmute myself. Are there questions that are coming up? No, it's you and Emma writing, isn't it? In the chat.
Yeah, no, it's just us at the moment. Yeah, so there's nothing new popped up in the chat.
Okay, great. All right, lovely. All right, so what you can see Beth has put in the chat are the links to the SurveyMonkey, and so this is the survey I was telling you about that gives you a chance to answer more fully to some of the questions.
That's the results in, so I'll just share that now.
Thank you. All right, brilliant, brilliant. Emma, does this get saved, doesn't it?
Yeah.
Lovely. Thank you very much, everybody, for giving us your feedback. We really appreciate it. Two more bits of information about Hub Cymru Africa's partners. SSAP is working with SSAP Youth and Hub Cymru Africa, and we have a call for your old photos. Anything that's 10 years old or more, we would love to see. We'd love to see any of your old photos from your time on the continent. We're having an exhibition in October to talk about what development means to you. So it would be really lovely if you could share those. There's an email address there that's developmentmedia20@gmail.com, or you can just email Hub Cymru Africa if you want more information. Similarly, the Fairtrade Wales is turning 12 on Saturday, so you can help them celebrate on Twitter. And of course, COVID-19 is impacting farmers and workers all over the world, especially given the challenges in working. So if you're so inclined, it's a really positive step to be able to search for fair trade. And if your local supermarket isn't accessible, then it's also available online. Ethical's Superstore and Tradecraft are brilliant, and they're still supplying, they're delivering to the house still. And then the next webinar, Emma, this is yours, isn't it? We're nearly there, guys.
I've just put the link in the chat as well. We had a webinar 2 weeks ago on e-learning, distance learning. And this is a follow-on really, because we didn't get a lot of opportunity for people to share their own experience and what they were doing in their projects. So this is more of a group discussion, and there'll be a presentation from Learning at Wales as well about their free Moodle service. So please come along.
Brilliant, thanks, Em. And then next steps. So we will send an email out with the resources that we talked about. And if anybody would like us to cover any topics in the next session, could you please put your hand up or type it in the question to let us know? That would be really helpful. And yes, please do follow the links to fill out the feedback forms. They are really important to us. Thank you. Yes, hi Sue.
I was just wanted to say thank you and how good it's been to see everybody, and all the very best to everybody.
Thanks, Sue. It's really nice to see everybody's face as well.
Mm-hmm.
Is there anything that anybody is interested in talking about at a next session? Is there anything that you think would be worthwhile talking about?
I think, as you said, Kath, Norbert's point about Black knowledge matters, you know, I think that's a really interesting one that we should look to take forward. But yeah, if anybody else has got any suggestions, do send us an email or yeah, drop us a line, that'd be great.
I think Gary's waving there. Gary, what would you like to?
Oh, that's right. I'd like to put something into an email, because, you know, between now and the next session. But, you know, when I say Black Lives Matter, you know, this is what Hub Cymru has been all about for many, many years. And it's not only Black lives, it's ordinary lives. And, you know, just keep on doing the great work and seeing how Hub Cymru can be not repositioned, be rethought of all the programs they're putting together, and for some reason they cannot do it. So what's the alternative? But to keep in the same ilk of the good work that they're doing.
Okay, thank you, Gary. Thank you. Okay. All right, great, lovely. Thank you very much, everybody, for your time. And we look forward to seeing you again soon. Thank you.
Thank you.
Bye-bye.
Bye. Bye-bye.
Jesus.